Late Night Health continues. I'm Mark Alyn. In a couple of weeks, we're going to be talking with a young woman from Tel Aviv who's a nutritionist, and she works with autistic kids in developing a diet so that, one, they get better, and two, they're off of medication. So we'll be talking with her in the next few weeks. Her name is Roni Enton. We're going to talk with a very interesting gentleman right now. I believe it was about 10 years ago he was diagnosed with pancreatic cancer. He survived, and my grandmother passed away from pancreatic cancer. It was very fast, within a month to 6 weeks, gone. It was also 30, 40 years ago that she passed. Last week he ran in the New York City Marathon. That's 26 miles. The thought of running 26 miles hurts my knees. Ken-Rybicki, welcome to Late Night Health.
Thank you. Thanks for having me on.
You ran that marathon in how long?
Well, it was 4 hours and 38 minutes to be exact.
You should be very proud of yourself. Your first marathon?
That was my third marathon. It was actually not my fastest, but it was 20 minutes faster than the last time, and it was tough. It was windy. It was cold. It was uphill all the way, as they say. But
right.
I was really happy. It was a great experience, to be honest with you.
So, how do you go from being an athlete, from a pancreatic cancer patient, chemo, losing 80 pounds, feeling like doo-doo, to being a marathoner?
Well, it's a great question. Actually, it was almost 12 years ago that I'm actually a doctor, and I basically diagnosed myself with pancreatic cancer. And just like you said, at that point in time, I really, with the way things looked and the staging and so forth, it was literally about 3 to 5 months or a survival chance. I remember my one daughter was graduating high school. This was in February, and I didn't think I'd see it. But, went through a lot of surgery, rounds of chemo, radiation, and it took a lot out of me, but thankfully it cured. And then what happened after that, a few years later, as I was trying to build up, that same daughter started doing some charity runs for this group. It's actually in California, Pancreatic Cancer Action Network.
Okay.
And she said, well, we're going out to San Diego. This was in '06, I think, and we're going to run this half marathon and raise funds. Can you help raise funds and maybe come out and support myself and my friend? I said, yeah. I said, but if I'm going to be raising funds, I'll just do it with you. So didn't get much training in, but kind of walked the thing, and I felt like I would never do anything like that again after I finished. But it turned out to be pretty fun, and then we just continued to do these charity runs and a lot of things we do to raise funds for cancer research. And I kept running and getting more interested in it and more healthy, and did a lot of other things to kind of build myself up. And that's just the culmination, is I still run and do a lot of it still to raise funds for cancer research. So it's pretty fun, actually. That's
amazing. Why is pancreatic cancer so devastating?
Well, there's a couple of things. First of all, it's very, it can be, as you said, very fast-growing. One of the major problems is it's very difficult to diagnose because it typically doesn't cause a lot of pain. It can in the later stages, but you don't notice it until it's actually grown and spread. And then because it's so aggressive, once it's spread, there's no surgery that helps it, and they're coming up with more treatments all the time, but obviously they're not good at curing it. So
I'm thinking of two celebrities. Michael Landon is one,
right,
and Patrick Swayze.
Right.
Patrick Swayze, both died of it, and in relatively short periods of time.
Yep, and that is the natural history of it. And as a doctor, I kind of knew that even when I had the diagnosis. So, I the day after my diagnosis, I basically went to my life insurance people and my will people and said, let's get everything straightened out because this is not going to end well. And again, at that point, typically the survival rate long term was about 1%. Now it may be up to 3 or 4% with some better surgical techniques and some new chemo agents. So it's still pretty grim.
Chemo was really rough on you.
Yes, I actually did a multiple chemotherapy regimen at the same time I was getting radiation, and it was about 5 weeks after a 13-hour surgical procedure. So it really took a lot out of me. I like you said, I lost 80 pounds, and you know the result of it was that I was barely able to walk up my driveway. You know, I was so weak, and it took so much out of me.
Would you think that if a doctor could spend more time with a patient, I'm doing a segue here.
Sure.
If a doctor could spend more time with a patient, the chance of finding cancer, arthritis, cause of a headache, anything, would be increased?
Well, yeah, and you know that is exactly the point. And I think, like you said, segue into the fact that 3 or 4 years ago I changed my own practice to what I call a personal health care program, where I have a very small panel of patients and spend a whole lot more time. And there is actually good research data that shows that those doctors that are able to do that spend a lot of time with prevention, wellness, screening, and paying attention to patients. I believe it's like 60 or 70% lower rate of hospitalization for those patients compared to a traditional practice where you might go in and get, you know, 3 to 5 minutes with your doctor, and until something really hurts and you're really sick, you don't get much attention. So, yes, that's exactly the way it is now, and frankly, that's why a few years back I changed my practice as well, because I didn't like that way of practicing medicine the old way.
But the average American, and I don't know what the average salary is, you know, it's around what, $40,000, $32,000 a year, can't afford to pay you $5,000 or $10,000 a year or whatever the fee is. So it's for people who are well off.
Well, that's actually kind of a misconception. Most of the, and you know, I'm actually in the Midwest, but I know even across the country, the groups that we work with, I work with a group that's actually out of Los Angeles that administers my program. They're called Signature MD. And, you know, the fees for that, I don't know about out on the coast, but in the Midwest, they're anywhere from like $1,000 to $2,000 a year.
That's all?
That's it. And, you know, most of them are not that much more than that. Now, you might be thinking of the Royal Pains type of thing where, you know, the guy goes to the beach house and, you know, stays there for a couple hours. But in general, we used to like to tell people, hey, for your latte, price of a latte a day, you know, you can do this. And my patient population is actually very middle class. It's people who've decided, hey, this is worth it. You know, my health is worth, you know, $1,500 a year, for me to make sure I get everything I need. And it's worked out. I've been almost 3 years now doing this. It's worked out really, really well. I've got patients that just love it, and I do really believe we pay a lot more attention and have done a lot of things that have helped a lot of people more than they might have gotten otherwise. So.
I think one of the letdowns of insurance is that they don't believe in preventive care. I'm going to add that Kaiser Permanente started with the idea of providing preventive care to their Kaiser Steel workers when it began, and Kaiser is the largest HMO in the country. But a patient who comes to you with Signature MD, in addition to that, also needs to have insurance in case of a catastrophic problem. They break their leg, they have a heart attack.
Right.
They have to go to the hospital.
You know, and the way the way the system is that I use is really quite good, because you still take your traditional health insurance, and you know the fee is the only, that one-time yearly fee is the only extra expense. So everything else is just as if you have your regular health insurance. And you're right though, and I think that, you know, everybody's up in arms right now about the Affordable Care Act, and there's a lot of it that, you know, even doctors are leery about. But one thing that is good is that I think we are starting to try to pay attention and, you know, have insurance coverage of more preventive and wellness services, and that's going to make a huge difference. And
as an MD, because you know, most doctors, and I checked this on the web today, get less than a week's worth of nutrition training which I think is a crime. They really need and should have more, and many of the new requirements are increasing that number. But on average, it's 23.9 hours of nutrition training. You believe in supplementation, personally?
Yes, absolutely, and that's one of the things that I've spent a whole lot of time. In fact, that's what I did when I was recovering. I do have a PhD in medical research, and actually I'm on faculty at the medical center here in St. Louis. But
in addition to your MD,
at University of Texas in Dallas.
Wow, a smart man. So,
well, thank you. But I decided back then that, when I was trying to recover, that we just really needed to learn. I needed to learn more about different things I could do for my health, supplements, vitamins, that kind of thing. And I am a very traditional physician, but still, I think we can all learn a whole lot more about just what you said. And I think that trend is continuing. So I actually developed a program for myself that involves some vitamins, minerals, and antioxidant supplements back in 2002 that I thought really helped me. And in fact, we decided to market that because of my patients asking me about it, and we use that to which we've had great success with in the Midwest here, and we use a lot of the proceeds there to donate to cancer research. So it's worked out pretty neat too.
What about other alternative forms of healthcare? Do you believe in like acupuncture, chiropractic, anything else that would help a patient relieve pain?
Yes, I think all of those things are very important, and I think general medicine and chiropractic and acupuncture and holistic medicine, there's always a bunch of really good practitioners that do very well and are very smart and do things right. And unfortunately, in any field of any type, there are sometimes people that make claims of trying to do things that they really cannot do, and I think that that's unfortunate. But yes, I work with a lot of different alternative healthcare providers, and they're very you learn in your area the ones that are very good and realistic, and they can be a lot of help.
And I want to go back to Signature MD. If I have a cold at 2 a.m. and you're my doc, can I call you?
Yeah, that's the really neat thing, because everybody gets my cell phone, my email. We have a private line in my office, but it's evolved into a really neat situation that I wouldn't have predicted back 3 or 4 years ago when I started, in that I answer a lot of questions, and we do a lot of things by email, by text. Text is great,
right.
And it might just be simple things like I need a refill, or even like you said, I have a cold. What should I do? And then
But what about at 2 a.m?
No problem.
No problem. Do they get you, or do they get somebody who's on call that you share with?
No, I carry my cell phone all the time. Like when I was in New York, for example, I got a call on my cell phone.
And you had to take it. The music is coming up behind us, so that means we're out of time. But we will do this again, okay, Ken?
I really appreciate it.
I appreciate it as well. Dr. Ken-Rybicki, a doctor in St. Louis, Missouri, and he's with Signature MD, a cancer survivor. Thank you, Doc. Coming up next, we're going to take a look at OrthoStop. And find out about dental health, snoring, and grinding of teeth. That's coming up next here on Late Night Health. Check us out at latenighthealth.com.